Direct care staff play a critical role in providing hands-on care and daily support to those living in adult foster care homes. The struggle to keep competent direct care staff is nothing new and has been one of the biggest challenges for decades. Ask any direct care professional how difficult his or her job may be, and they will provide any number of responses, including job-related physical pain and injury, intensive relational skills and emotional labor, increased acuity of resident conditions, and challenging behaviors due to Alzheimer's disease and other dementias. Some other challenges direct care employees face include heavy workloads due to high turnover, scheduling challenges, limited training and career advancement prospects, and inadequate supervision and management. The residents at adult foster care facilities often rely on a team of staff for care. They are likely to get better care when they work with the same people consistently. That's because staff gets to know each resident and their specific needs. But when turnover is high, there's less familiarity, and residents don't get the care they need. That can increase their risk of developing other illnesses. There are many reasons why employees may quit their jobs. Some reasons are more common than others, and sometimes there are a multitude of reasons. The following are some of the reasons why employees may quit: lack of experience in the field, lack of commitment, short staffing, poor wages and benefits, and negative relationships between employees and their direct supervisor. Some other reasons why employees may quit their jobs include lack of appreciation or recognition, disrespect from supervisors and managers, poor working conditions or environment, and a work schedule that fails to meet the employee's expectations. One of the most important jobs you have is retaining good employees. The following are some employee retention strategies. Treat people like they are your most valuable asset because they are. Find ways to get employees to fall in love with the facility and residents they care for. Tell stories about your facility. Share its history and mission so that this is at the forefront of your employees' minds. Put employees where they belong based upon their skills and experiences. Recognition, fair treatment, and respect go a long way. Some other employee retention strategies include taking time to laugh with your staff and have fun at work. Employees who trust you and the organization are more likely to stick around versus those who lack trust. It takes a long time to earn trust and a minute to destroy it. Employees who feel like they are being listened to are more likely to stay. If you listen to them, it says a lot about your character, values, principles, and how much you value them. Create a mentoring program so that new employees are not left alone. Employees who form relationships with other employees generally stay longer. Implement inexpensive short-term incentives to keep your staff motivated about work, new policies, or programs. Learn about the needs of your team, and their loyalty and commitment to you and the residents will grow. Be diligent about having the right equipment to get the job done. Retaining good employees starts with recruiting and hiring the right people. This is easier said than done. However, when employees don't fit in, aren't good for their position, or don't feel attached, they leave. Most employees like routine and want consistent assignments. They like predictability and not too many surprises at work. Help staff cope with stress and address underperformance before it is too late. Always be clear about work-related expectations. Train supervisors and managers to act and behave like leaders. If you give managers and supervisors authority, let them exercise real authority. Involve employees in daily decision-making. Asking your employees if there is anything they need from you can be a signal that you appreciate them. Do everything in your power to make sure employees feel prepared and are well-trained so they can deliver excellent care. Flexible work schedules are now the norm, and the adult foster care industry should not be excluded. To deliver exceptional care to residents, staff must have the freedom and flexibility to take care of themselves. To help with turnover, consider adopting a flexible work schedule. direct care professionals face many challenges and are often not valued for their essential role in caring for vulnerable adults. Licensees can confront these challenges by investing in competency-based training, providing living wages and benefits, and offering career development opportunities. Some good employees will inevitably leave sooner than you'd like, but you can at least make their decision a little tougher. For those employees who leave knowing they were valued, they will likely say good things about your facility and perhaps even come back to work for you in the future.